AIDS is acquired immune deficiency syndrome. It is a disease in which the body's immune system breaks down and is unable to fight off certain infections, known as opportunistic infections and other illnesses that take advantage of a weakened immune system. HIV, though, is a human immune deficiency virus that causes AIDS. It is a member of a group of viruses called retroviruses. HIV infects human cells and uses their energy and nutrients provided by those cells to grow and reproduce. When a person is infected with HIV, the virus enters the body and lives and multiplies primarily in the white blood cells. As the virus grows, it damages or kills these cells and other cells, weakening the immune system and leaving the individual vulnerable to various opportunistic infections and other illnesses, ranging from pneumonia to even cancer. The U.S. Centers for Disease Control and Prevention, CDC, defines someone as having a clinical diagnosis of AIDS if they have tested positive for HIV and meet one or both of the conditions. They have experienced one or more AIDS-related infections or illnesses, or the number of CD4 cells have reached or fallen below 200 per cubic millimeter of blood. This is a measurement known as T-cell count. Next, in healthy individuals, the CD4 or T cells count normally range from 450 to 1,200. Most remain asymptomatic for 10 to 12 years, and a few for much longer. The Joint United Nations Program on HIV/AIDS estimates that there are now over 34 million people living with HIV or AIDS worldwide. Most of them do not know that they carry HIV and may be spreading the virus to others and not even know it. Here in the U.S., nearly 1 million people have HIV infections of AIDS, roughly 1 out of every 250 people that estimates to be. At least 400,000 Americans have become newly infected with HIV each year, and it is estimated that half of all people with HIV in the U.S. have not been tested and do not know that they are even carrying the virus. Since the beginning of the epidemic, AIDS has killed nearly 19 million people worldwide, including that 425,000 Americans. A person who is HIV infected carries the virus in certain body fluids. This includes blood, semen, vaginal secretions, and breast milk. The virus can be transmitted only if such HIV-infected fluids enter the bloodstream of another person. The processes are unprotected sexual intercourse, either vaginal or anal, with someone who has HIV infected, unprotected oral sex with someone who is HIV infected, shooting needles or syringes with someone who is HIV infected, or infection during pregnancy, childbirth, or breastfeeding, mother-to-infant transmission.
There are many problems facing those who live with HIV and AIDS today. Clinical barriers to effective HIV palliative care include a lack of skill among physicians in recognizing and managing symptoms, particularly in pediatric HIV. Additional clinical barriers to pain control that have been identified include a lack of knowledge or access to pain management experts and concerns about patient abuse and addiction with respect to pain-controlling drugs. It has been found that hospital patients' satisfaction is higher on AIDS-dedicated wards, and a patient preference has been identified for specialist wards and clinics due to a perception of better confidentiality and expertise. However, a study of patients with terminal HIV reported preferring hospice as their place of terminal care as it enabled them to conceal their diagnosis from relatives by describing their disease as cancer. Data found 36% of nursing staff would wish to refrain from nursing people with HIV, and assistant student nurses were more likely than other nursing staff to wish to refrain from nursing gay men with HIV. Poor HIV/AIDS patients have been shown to experience more uncontrolled pain and a greater likelihood to die in a hospital, despite receiving a higher number of psychosocial services, and less educated patients report comparatively more inadequate analgesic treatment. Treatment is complicated, and there is an ever-present danger of the virus developing resistance to the drugs. Damage to the nerves in the feet and lower legs is common and can cause excruciating pain. Some of the drugs raise the levels of blood, fats, and sugars, increasing the risk of heart disease and diabetes. Others can cause the stripping of fat from the limbs and face, or accumulation of or the accumulation of fat around internal organs in the neck. AIDS has been transformed from a death disease to a chronic illness. Many people avoid testing and treatment because they are terrified about the potential consequences of a breach of confidentiality, like social stigma, rejection by loved ones, being evicted from an apartment, losing a job, and suffering harassment or violence.
Violation of medical privacy was one of the most frequently reported civil liberties problems faced by people living with HIV/AIDS. All over the country, health care providers, pharmacists, law enforcement officials, government employers, and schools are violating state and federal laws by disclosing HIV status without permission. In New Mexico, a patient first learned that he was HIV positive from a receptionist in front of a waiting room full of people. In Fort Worth, physicians sometimes tell a family member about a person's HIV status before telling the client. Many providers think HIV positive people should be forced to tell others. In Florida, people refuse to pick up their medication from the health department because they're afraid someone will see them. A Minnesota provider said most people do not understand the difference between confidential and anonymous testing and need to know what information will be released to insurers, employees, and family members. A teacher in Florida informed an entire class that a particular student was HIV positive. A family counselor in Alabama told the school that a child's mother was HIV positive. A school in Detroit threatened to disclose a child's HIV status to all teachers and administrators. Police in St. Louis found a young man's HIV medication when they searched his car and disclosed his HIV status to his father, saying the father had a right to know. The New York City Department of Health disclosed a person's HIV status to his employer in the course of making partner notification calls. Medical charts in Fort Worth are labeled on the outside with a sticker indicating that the patient is HIV positive. Clinic employees and pharmacists in Florida disclosed people's HIV status to others in the waiting area by shouting out information about their medications and identifying which doctors they were coming to see. In small towns, people are often in serious danger if their HIV status is revealed. One provider had to help 3 or 4 people get out of a small town in Texas because of hate mail and vandalism to their house. In Tallahassee, there are at least 10 complaints a year from people saying they were fired because of their HIV status. An organization for those living with HIV/AIDS receives an average of 1 complaint a week about firings or demotions based on HIV status. One Texas employer asked an employee to get an HIV test because the employee was gay and had been sick. A flight attendant had a job offer retracted because he failed to list HIV medications on an application form but disclosed his HIV status after being hired. One Texas employer even required an HIV-positive employee to use a different bathroom, eat in a separate location, and to wear long-sleeve clothing in the summer. All over the country from Alabama to California, doctors, dentists, skilled nursing, and psychiatric facilities and drug treatment centers refuse to provide services to HIV-positive patients. Emergency medical providers in Dallas and Fort Worth refuse to treat people who are HIV positive, and police officers wear gloves to transport HIV-positive detainees. In the worst cases, people die as a result of discrimination in medical care. One man died a week after he was turned away from a Texas emergency room. Although the man had no transportation, the doctor wrote on a prescription pad, "Go to GPS," referring to another hospital an hour away that had an AIDS unit. Many residential nursing, drug treatment, and psychiatric facilities blatantly refuse to accept patients who are HIV positive. Others have unspoken rules about it. Some nursing homes say they do not even have enough experience to care for patients who are HIV positive, even when they are entirely asymptomatic.
How can you help fight HIV and AIDS? Everyone can play a role in dealing with this epidemic. Here are just a few suggestions for how you can make a difference in the fight against HIV and AIDS. Volunteer with your local AIDS service organization. Talk with young people you know about HIV and AIDS. Urge government officials to provide adequate funding for AIDS research, prevention, education, medical care, and support services. Speak out against AIDS-related discrimination. And support continued research to develop better treatments and a safe and effective AIDS vaccine by making a donation to the Foundation for AIDS Research.